Well, hey, good to see so many of you today. I know it's been a little while since we've had an office hours, so we'll talk a little bit about that. What's been going on at WIHA over the last several months, and I look forward to hearing from you a little bit too about what's going on in your area. First, I want to introduce Chris Klotz. She's the past president of the WIHA board. And we're gonna just take a moment to, I think all of you were informed that our executive director, Dave Nelson, passed away on July 22nd of this year. So we're just gonna take a second and remember Dave.
Thank you, Chris. Yes, we do want to just pause for a second and think about Dave and remember him and his contributions to WIHA. He wasn't with WIHA very long, but he did leave his mark. He encouraged a lot of new ideas and some creative and big thinking, and we will miss those things about him. He was also an advocate and he was a comedian. He loved to accomplish things through storytelling. So we will miss that as well. At the same time, our friend and colleague Shannon Myers moved on to a new opportunity, and we wish her well. This created a time of pretty significant transition for WIHA. And I want to assure you that the board of directors is very committed to the future of WIHA. Several members are working with staff during this transition time. And we have such confidence in the strength of this staff, and their work, especially at this time, has been very impressive. And I think you will all be seeing today some of the outcomes of some of that energy and work that they've been doing. So there are a number of exciting changes, and I think many of them will help you as you spread healthy aging across the state. WIHA's primary goal is to continue to support our provider partners in the network throughout this state and throughout the country, to many of providers who are our partners who are outside of the state. And we want to ensure healthy aging programs are available and accessible throughout Wisconsin. To strengthen our ability to do this, I'm pleased to announce a few staff changes. First, very pleased to let you all know, if you haven't heard this, that Chris Kwasnowski has been appointed the interim executive director. In addition, she will continue her role with communications, so we don't lose her talent and inspiration that comes to communication that we all benefit from. Then next, Jill Rankin is now the Director of Program Implementation, and her focus will be on growing and supporting our provider network, both in Wisconsin and throughout the country. Erin Eggert is the Director of Information Systems and Physical Activity Programs, and she has responsibility for the website management and for physical activities programs. And you'll see more about the website in just a few minutes. Karen Beck is the Director of Administration, which you know her in that role with logistics and fiscal support. And adding to her roles, we will be using her artistic talents to support Chris with communication support and strategies. So then let's see, forgot one. Ella Young, is the Health Promotion Program Manager. And we're currently recruiting for 2 positions that will support programs that are offered through WIHA. So we're recruiting for a fall prevention program coordinator and a chronic disease self-management program coordinator. You'll be hearing more about those, and hopefully you've seen those announcements, and we encourage you to think about it, to let your friends know, and hopefully we'll find some great people to fill those positions that will then help you and your communities to implement more healthy aging programming. So now I turn it back to Chris.
Yeah, thank you so much, Chris. Chris turns it to Chris. Yeah, so we're, it, it's certainly been a time of transition for us. But again, as Chris said, for first and foremost, we're looking to maintain the level of service to our provider network. It's just been like honestly, we've all been sort of in a with the COVID, challenges, and now some of our staff losses here. We've been I think in some ways it's brought the staff even closer together in terms of our ability to support one another. But we're going from, a staff of 7 to a staff of 5 back to a staff of 7 plus. So we do hope that you are, those of you who are interested and willing to take a look at the positions that we have to offer. We have a falls program, falls prevention program manager position available. That position would really be in some ways a replacement to Shannon, although Shannon had some responsibilities that would not be part of this position. But because we have a new grant opportunity that or funding that's come our direction in the Falls area, which I'll talk about a little bit more in depth in a little bit. But the Falls Prevention Program Manager will be a full-time position, and it will have some responsibilities around data gathering. That's a new component of things that we hadn't had in the past. We'll be looking to that position to manage our stepping on programming, which Erin Eggert is taken on temporarily until we can have this position hired. The position will also be responsible for working with our Falls Prevention Coalition, the Falls Free Wisconsin Coalition, and again, be the driving force behind the Falls Free Wisconsin Center, which I'll be talking about later again. So that's sort of the idea behind that position. The other is really a chronic disease self-management program manager. So to manage the number of chronic disease programs that we have, from Living Well to Healthy Living with Diabetes, Healthy Living with Chronic Disease, chronic conditions, our chronic pain program, and the Spanish language programs potentially that are also part of those programs in addition to mom. So we're looking for someone who can be both the training and technical assistance provider for those programs, and that position would be then reporting to Jill, who has so much experience and expertise in that area. So I'm not sure. I'm going to just check the chat. Maybe someone could quickly put the link to those positions in the chat. So if you're interested in taking a look at that, you can do that. Otherwise, we will push ahead. But as you have questions, again, there's no wrong door at WIHA. So those of you who have been working with specific people on specific things, we're going to continue to respond. And if we'll hopefully be able to show you on the website if there's an additional person who's going to be working in a specific area, we'll try to make that real clear. So again, thanks everyone for the well wishes. I do appreciate that. And we'll move forward. Next, we're going to talk about expanding WIHA's role in healthy aging programming to support program providers. We had planned when we had our last office hours scheduled to talk about this at that point. So we have been recognizing, and I think the pandemic has sort of precipitated our thinking in this area of what are the ways that WIHA can support program provision in the state, in addition to the kinds of things that we're doing now with training and technical assistance. So now we're going to talk a little bit about those things. If I can just advance my slide. There we go. And I'll send this over to Jill.
Great. Thank you, Chris. So we have been, of course, always, but especially over the past couple of years, really trying to collect from all of you. What are we seeing as challenges? What are we seeing as successes when it comes to providing these programs in this new world that we're living in? And we know that For sure, the overarching theme has been that there are demand challenges and there's been supply challenges. And the reason why we're focusing on challenges isn't to be in a more negative perspective, but how can we then help meet those needs and help make it easier for you all to do the wonderful work that you're doing in your community. So we know that there's recruitment issues, especially now during COVID and during this age of having virtual programming, that it is a challenge to recruit participants for those virtual programs. So how do we address that, and how do we not address that, but how do we enhance that at WIHA? We also know that there are supply challenges as well, because especially now, we know that workforce shortages are happening. People are stretched thin with different responsibilities that they are now attending to in regards to recovering from all of this COVID stuff and just overall in general. So how do we get more participants, but at the same time address capacity challenges? Maybe we can't necessarily be able to accommodate more participants. So how do we address both of those things at the same time? And really what we're going to talk to you about today and propose is some strategies as to how can we then create more of an atmosphere of participants across Wisconsin wanting to engage in programs. I'll talk a little bit about the supply part as well at the end, but we're going to really focus on how do we then engage people more into not just promoting the programs, but how do we get them ready to take workshops, to engage in the services that you're providing. So we see our role at WIHA as being unique because we can do that. Where you all are promoting the workshops, we are seeing ourselves being able to step back and take a larger picture view of how can we engage people into their health, just first and foremost into their health. And then therefore, when they're ready to take a workshop, they'll be able to engage in those things that you are promoting at a local level. So some of the short-term strategies that we've done and we're going to continue to do is coaching and technical assistance, providing assistance with virtual programming. We are going to hear from Erin today on our barriers to participation survey. We wanted to hear from older adults themselves as to what is getting in the way for them participating in the programs. We have worked with some of you on the call today on doing some different marketing strategies, whether it's different messages and also paid advertising and things like that, to see if that might help out. So we're going to continue to work on those things, but our long range strategies is to really, like I said, increase that demand. And how we're going to do that is we are going to engage with consumers directly. Where in the past, WIHA has been more engaged with you all as program providers and facilitators, and we are still going to continue to do that. But how we want to support you we're not looking to go around what you're doing. We're looking to enhance and support what you're doing. So our direct communication and involvement with older adults in Wisconsin is going to be meant to supplement and enhance and prepare people for what you're doing. And then, like I said, increasing that supply. And I'm just going to expand a little bit on that demand side. And the reason why, the theory behind what we're thinking here is when you look at health education, public health in general, we know that there's probably maybe 1% to 2% of the population that are ready to engage in programming, ready to engage in something like an evidence-based program, or even join an exercise club or things like that. So there's a very few people that are ready in that action stage. If you look at activating people, they're either in pre-contemplation, where they're not even thinking about making a change in their life, to some then moving towards contemplation. Oh yeah, I'm thinking maybe it's the new year and I want to join the YMCA or something like that, to then preparing, and then in that action stage, they're actually going to be doing something for their health. So what we're aiming to do is get people into that get the people who are in pre-contemplation right now, who are not even thinking about health or taking a workshop or anything like that, and how can we then move them to contemplation, to thinking about it? And that's really the theory behind it, whether you're using health belief model theory or some other health education practices to be able to do that by the strategies that we're going to talk to you about today. So there you go. I'll hand it over to you, Erin.
All right. So as most of you know, we have completed a survey that was distributed between May and July of this year. We asked many of our program providers to assist us with the distribution of the survey, and many of you did. So this survey was specifically asking about barriers to participation in evidence-based programs. We asked a few additional questions which we gained insight from, but largely that was the purpose. And we did differentiate between in-person classes and virtual classes to really see what participants or what older adults in general were responding to in terms of what was the barriers that they face. So on this side, you can kind of see the distribution in terms of how we did that ourselves. So we sent emails out to past participants within the past 5 years on 3 separate occasions. You can see how many were sent there and then the click rate from that. And then we shared on Facebook and how many people were reached and how many clicks from that. Just note that with Facebook, it's likely that one person might have seen that all of those 6 times, so those would be double counted. So we think we reached at least 417 people, individual people on Facebook, with the potential of reaching about 1,300. We did distribute this by phone calls. So we had one of our interns make 100 phone calls. Unfortunately, most people do not want to complete surveys by phone any longer. So we only received 6 responses back from that. So do note, we were trying to do that in the chance that somebody wasn't going to a place of where a program provider was and they didn't have access to a computer. So try to make sure that those people were getting access to that survey or were represented on that survey as well. But due to the low response rate, we just have to keep that in mind as well. We did have over 240 paper surveys. So that was by many of you, our program providers, who distributed it to members of your facility and then sent them back to us so that we could get some responses for people who might not have access to an online survey or be able to complete it online. And then we had the rest were virtual surveys. So we had over 450 virtual. So in total, we had 705 surveys. And this just kind of shows you the age range that we got for survey respondents. And then we had, in terms of gender, we had 571 females, 109 males, and then 24 who preferred not to answer. And this kind of just shows the racial and ethnic identity of the individuals and how they self-selected. So the blue bar is what the survey respondents were, and the orange bar is the census demographics for the state of Wisconsin. So you can see how representative or not representative those lines are for each of the different races. We asked if people lived in an urban, suburban, or rural area, and you can see those responses here. So try to get a good spread of that. And then one of the first questions that we asked was, what does healthy aging mean to you? And so we asked people to select all that apply, and most people selected all of the respondents or the available responses. So having enough money to take care of family and themselves, feeling like they're giving back to someone or something, having a sense of meaning, able to continue to learn new things, filled with joy, happiness, and love. They're surrounded by people like friends and family. They don't have problems with mental health or memory. They don't have any health problems, or they can manage their health problems. And then that their body is able to do the things they want when they're older was the #1 top response. The next question we asked was, which of the following is a concern for you as you get older? And our top response with that was preventing falls. So there are a lot of older adults that are concerned about falls in our state. That was followed by improving health by being more active, preventing or a concern with losing their independence, and then brain health as well. Those were those top 4 responses. When we asked, would you be interested in attending a workshop that is proven to address a health concern? The majority of people did say yes, so 503. And then we asked them to select any challenges that would prevent them from attending a face-to-face. So this is that barriers question of why are people not participating in in-person programs? And largely above all others, people are just not aware of programs in their communities. So that was the top response, and it was the top response on the virtual one as well. And keep in mind that although not all of the respondents were past participants, many of them were past participants. So even the past participants are not aware of programs available in their community. The second top answer was that there's still a lot of fear around COVID or other illnesses. So they are hesitant or don't want to attend in-person programs because of that. Followed by that some people just prefer to get health information in a different way. And then this is the same question. So barriers for attending virtually. You can see again, the top answer was they're not aware. And then second top answer is people are not interested in online programming. I think we have heard from many of our program providers over the past 2 years. There was a big interest for this back in 2020 when people were stuck at home. You didn't have another choice. But now people are not wanting to do Zoom any longer. People are done with that. They want to be seen in person again and be able to get that experience with other participants as well. And then the third answer or highest answer for here is not feeling comfortable using a computer to attend. Then we asked them, this is for your information, where would you like to get information about health education opportunities? So the largest answer here is newsletters from a senior or elder center, an ADRC, an aging unit, that kind of thing. So older adults are really saying that those newsletters are valuable to them. That's really where they go or where they would want to find out information about health promotion opportunities. The second highest is their doctor. I know that there are many of our program providers who are trying to work with doctors or healthcare providers in the communities, but we know that there are some barriers with that as well. But that is a top place for participants or potential participants of where they would want to learn that information. And then the third highest one was local health departments. Then we asked a open-ended question here of what would you want to get out of health education opportunities? So I went through all of the responses and kind of tallied up like how many of each of these we got. And the top response we got was ways to maintain or improve health to live longer and or healthier. Another one was saying they want up-to-date information on new research about aging. Support was another big one. Ways to stay physically and mentally active. Tips to stay independent. How to learn more about aging in place. Memory or brain health information. How to improve their quality of life. How to talk with others about their problems and how they got help. So that social support. And learn more about resources that are available to them. And then information about things I can do in my own home. And there was a few other, but those didn't have quite as many responses on the right side. And then we did ask everybody whether they've ever heard of WIHA before. Again, keep in mind that most of these participants have taken a WIHA program. So not everybody, but most of them have. And largely they said no. So that's just information for us here at WIHA, that participants don't associate us with the programs that you guys all do. And then we ask people whether they have completed one or more programs. So this question we didn't add until afterwards. So many of those blanks are just because those people didn't see that question. So of the people that did see the question, we can see that some of them did say yes, and then we still had, about a third that said no as well. All right. So just to follow up on that, so with this survey information, what we have done is we've had 2 focus groups so far with some of our program providers, and where we kind of identified these concerns that the participants shared in the survey. We brainstormed some solutions to those concerns, and then we mapped out those solutions in terms of feasibility and importance. So WIHA is going to continue working on those and helping our program providers, as well as doing what we can to help older adults across the state become more aware of these programs and be able to take more or learn more about the evidence-based programs that are available to them in their community.
Yeah, and I think maybe it's a good time to just take a second. Would love to hear from any of you if you want to put it in the chat, any reactions to this. As Erin said, what precipitated this was so we had a better understanding of what were the barriers to people participating in programs. So we really want this to be useful, kind of rich information, both for you and for us, in terms of how can we help support the programming and the increasing the demand for that programming in your communities. But I think our reaction to it has been some of what you're going to hear next, and that's in talking about, as a response to this, what is it that WIHA can do to help increase demand? So I'm just looking at the questions from Amanda. Were there any questions regarding the length of workshops or number of workshops part of a program as a barrier?
Yeah, one of the questions did ask about that or listed that as a barrier. It was not identified as one of the top barriers. So we did ask whether just other commitments was a barrier to them, or whether the length of the workshop, and there were certainly responses in that area, but it didn't come out on top.
Mm-hmm. And keeping in mind that it wasn't all people who'd taken WIHA programs, so they didn't necessarily know, about the programs, each individual program, and how long they might be. So that would be they wouldn't have had any foreknowledge, some folks, about how long programs might be. So it'd be hard for them to gauge that. Asking if the slides will be shared. Yes, shared. And I think we want to figure out ways that we can work together with you to come up with some additional strategies to put some of this new information into practice, so that it provides benefit to all of us. Lisa asks, were there any questions asked about where they wanted to take a workshop? At a local senior center, library, must be in town they lived, willing to travel, etc. Is there anything about the location?
No, the only thing that we asked was whether they would be interested in taking a class online, but in terms of location for in-person classes, we did not ask that question.
Mm-hmm. Any other questions about this? Were the surveys offered in languages other than English?
No, at this time it was not.
No, we didn't.
Quite a few of our partners in different communities administer some of those surveys, and some of them did them verbally. And I know some of our Spanish language communities that was done. So we did get surveys back from those communities, but the actual survey itself wasn't in Spanish.
Question,
would WIHA ever think of partnering with insurance companies, something like Silver Sneakers? Yes, and have done that in the past. Worked with several different insurance companies and MCOs to offer some of our programs. And it was somewhat challenging for a variety of different reasons. But that's not to say that's not something we explore again in the future. I think we'd have to identify some good strategies that, matched up with our capacity to deliver programs. But it's a great thought because, again, we're always looking for opportunities to move programs into the community, whichever doorway that takes. So I think it's a good reminder that there may be other opportunities, and the landscape is kind of constantly shifting. So there may be opportunities to do that down the road. Any other reactions to this or questions? I appreciate the ones that are popping in there. These are great for us to ponder. Okay, well then we'll move forward. I'm just gonna talk about this one slide and I'm gonna turn it back over to Erin again. So how does WIHA increase demand by direct consumer engagement? What does that actually look like? So one of the things that Erin's going to show you in a second is that we have developed a brand new website that's really built with consumers in mind. It's a little more consumer focused. As we think about moving direct to consumer, our former site had content that consumers could access, but it was really built with our provider network in mind. We really wanted to be a place where providers could come, get the tools and resources they needed to put on their programs. It continues to be that type of site, but we wanted to add an additional, more robust section for consumers to be able to find information, not just about programs, but about healthy aging practices as well. So this new consumer-focused website and soon to come a provider portal, which we don't have ready yet, but is coming, will provide this information on healthy aging and healthy living, offer some interactive features to encourage behavior change and action planning. And I think those are the things that will evolve on the site as we kind of get a little bit more. Some of this is sort of based on what are we going to learn here as we start communicating more with consumers. Will we want to better understand what types of information and how we can provide it to make it as actionable as possible, sort of following that, what Jill said about, people being ready to take programs. We want to, enhance that. We will be simplifying workshop registration, so that will be on the WIHA site. We don't currently have the ability to do that, but we are going to be moving in that direction. It's gonna, well, that's another piece that I won't talk about right now, but there will come a point where people will be able to register for all of the programs right from our website. And again, demonstrating a commitment to equity and inclusion throughout this process, wanting to make sure that we're thinking about and looking at the different ways that people in different communities, culturally, geographically, from a disability perspective, are able to access information on our website. So with that, we're gonna attempt. I'm going to stop my share and attempt to hand it to Erin so she can show you the new website.
Great. All right. Switch my screen around here. Okay. So this is our brand new website, which went live yesterday. So if you've been to the website yesterday or today, you've probably noticed the change. I've gotten some emails that were a little panicked about getting into program materials. So we'll kind of walk through that today. The big thing about the new website is that from here on the front page, this is really consumer focused. And what we mean by consumer is older adult or any individual who is interested in learning how to age well. So that's where the focus of this front web page is. All the information most of the information from our page previously is under the For Professionals tab, and we'll get to that, but I just want to walk through the page as a whole first. So when you come in and log in for the first time, this is what you'll see. We do have a little pop-up for our newsletter. This newsletter right here is really meant for consumers that are interested in getting our newsletter. So keep that in mind as well. We do have another newsletter for program providers too. This right now it was set to pop up every time, but we'll turn that off as soon as we're done sharing with all of you. And then once you press close, it won't pop back up every time. When you come to the main page, it will scroll through a couple pages, but those same pages are seen below as well. So we have one of our big focuses is on aging well. So if you click on the Age Well, which is also here at the top, this is information for those consumers to find how to age well in the community. On this page, we specifically talk about the 8 dimensions to wellness, and we have a breakdown box for each of those dimensions. For a dimension that WIHA has a program in, we then link to finding a workshop in that program. If we do not have a program, so such as financial health, we still know that that is an important factor or dimension of wellness. We link to other high-level resources in each of these tabs that people can go to and access outside of our website, but is still a strong and quality resource. We also have this new healthy aging assessment. So if you click on this, you can download this, you can complete it online, you can print it off and distribute it. But this is meant to walk through and help somebody identify which categories they're doing well in terms of aging well, and which they may want to put a little bit more focus on as they age well. So we have several different dimensions in here. So physical activity, each question, there's a question with response, and then you give yourself points. And then at the end of the document for each category here, so here's all the different categories, it would tabulate your points, and then you'd see your total score. And then you can see how you rated in terms of aging well. So whether you got scored poor in that you're doing a couple different lifestyle choices that could be improved to help you age well or help you to age better, fair or good. And then in each of those dimensions also, there's different tips. So somebody could go back to those tips and see what they could focus on in that area to help them age better. We also have what we're calling WIHA initiatives. So under Age Well, WIHA initiatives. And these are things that WIHA is doing across the state or within communities, or that we're working with these program providers, you all, to help people age well in their community. So if you go to Age Well, WIHA initiatives, this page is still consumer focused. So we're really telling those individuals what we are doing or what we're collaborating with in their community. So these are the different initiatives here on what WIHA is working on with program providers to help them age well in their community. And we also have these same initiatives under for professionals with resources. So that's where you as a professional would go to access the materials for those different initiatives. So for example, Falls Prevention Week next week, and it's Fall Prevention Month. If you wanted materials for that, you'd go to the initiative resources. And then under Age Well, this would just be for those older adults to go to and learn what WIHA is doing. Okay. I'm going to go to programs and workshops. So this is the information or the public facing page to find more information about any of our programs. So we have it categorized up here at the top if you wanted to click on a category. So if you were looking at just Be Active programs, you could click on that, and then it would just take you to a page that listed all of our Be Active programs here. Or if you just wanted to see all of the programs in one spot, then that's what that programs and workshops button is. So we have all of our programs here. We have a little blurb for each of our programs. And then if you were to click on any of them, they're all set up in a similar way. So it will list the program. Some of them will have a video that will be listed. Not all of them have a video. And then all of them have these buttons. So these will describe what the PALS or what the program is, who is it for? That's that target population. So that's set per program. The research, if we have research articles, or we list the evidence-based outcomes there. And then we have testimonials from past participants. And on each of these pages, we also have the Find a Workshop in Wisconsin button. So I'm going to go back to the Programs and Workshop page. And then on this page, we also have the Find a Workshop button. And underneath Programs and Workshops, we have Find a Workshop. So I'm going to click on this. This is a brand new page, which we're hoping it will be a little bit easier to use than our previous page. You can see we have this beautiful map that lists kind of the different places that we have programs. So somebody could scroll in to the map to see. If you click on one of these, it will show you where the programs are, what the workshop is, when the dates is. So you could view it by location, or you could scroll down and see the different programs. And then you could view the program by the schedule. So I'm going to click on Stepping On, because I know we have programs there. And you can see all of the upcoming Stepping On programs. And then if you were to click on details, it will show you where that class is and then the date. And then I see this one doesn't, but most of them will tell you how to register, who to contact. I am in the process of going through this database and making some changes. So if things are missing, that's why I'm working on that. But most of them should have who to contact or how to register for that class right here as well. And then as Chris alluded to earlier too, eventually when we have our new database all up and running, somebody or an older adult will be able to come and click on the details. And if they want to register for that class, they'll be able to register right on our website. And then that would go right to you as a program provider as well. So that is coming in the future. All right, then I'm going to go to For Professionals. So on our For Professionals page right now, because most people are new to this brand new site, I have this video that automatically pops up. If you want a little review of what we go through today, you can watch the video. If you don't, close it. I'll remove that at some point, but we're just going to leave that for right now to help people kind of work through this. So some of our program resources or some of our For Professionals materials are password protected. If you remember our old website, you had one username and password per program. You will now have one username and password for you as an individual, and you will be granted access to more than one program based on your credentials. So when you register for the website, I look to make sure that you are an active leader or program provider or master trainer or license holder. And as long as you are, then I'll add you to that group and give you access to that page. So once you have that, you'll be able to see all of the program materials. If you ever don't have that and you think you should, then you can just contact me and I'll grant you access to that if that's needed as well. And then if you're taking a class, eventually, once we get everybody loaded up onto the website, if you take a new leader training, that will be part of our automatic process where we'll go in and add that credentials to your username and login there. So on the For Professionals page, you can see all of the different things that are really meant for you as a professional. So we have our Become a Facilitator page. And this is also in our drop down here. So this is where you would go to find out all of the information about each of the programs and what you need to do to become a facilitator for that program. So as an example, I'll click on our PALS program. We have the step 1, so learn about the program, make sure you're connected to a program provider or license holder, view the mandatory orientation video. We have one of those for all of our programs. Some of them have an implementation guide, which helps provide you more information. And then there's the leader training application. So you'll need to do all of those steps. In addition, on this page, we have our 2022 facilitator training schedule. So that's just through the end of this year. We have our brand new 2023 facilitator training schedule. I'm just going to click on that quick. So this is set up similar to the Find a Program, and that it will lead or list all of the workshops that are coming up in 2023. If you click See Schedule, you'll see right now there are 3 stepping on training scheduled for 2023. And then if you click on that, it will have that, it will have the link to register for that right there as well. You'll be able to see when and where that is, and then how to register for that. So that is the facilitator training schedule page for the 2023. Then you can either press back or return to become a facilitator to get back to this page. In addition, we have our training fees. So that just lists the fees for becoming a facilitator or a master trainer. Those, I'll just put a footnote there. Those might be changing, but we'll make that final determination by December 31st of this year. And they would only be changing a little bit. And then there's our program requirements. So that's like your minimum and maximum per workshop, how many workshops you need to lead as a facilitator in order to keep your active status, and how many leaders are needed per program. Anybody has questions, stop me as I go. All right, then we have back on our For Professionals page, the become a program provider. So this just provides information on how to become a program provider, what it means to be a program provider. If you want to look at that, you can, but I think most people on this call are aware of that. Most of you are program providers. License holder, those are just for our outside of Wisconsin organizations. So everybody here in Wisconsin is under the WIHA license. We are your license holder. We license some of our programs like Stepping On and Mom to other states. So they go there to do reporting and such things like that. Program resources will be the big page that you all are interested in. So this is where you access your materials for the program. Okay. So in order to access any of these materials, you'll need to be logged in. So for example, I am not logged in right now, and I'm going to get this screen that says I need to log in. So I'm going to press log in here. Then I'm going to log in. And it will auto redirect to the For Professionals page. So I'll go down to the program resources. And then I'll be able to click on any of these that I have credentials for. Okay. So I'm going to just click on Mom as an example here. And this is what all of the pages are going to look like. So instead of having 3+ pages per program, so it used to be that our planning your workshop was a separate page, promoting your workshop was a separate page. We now have everything just on one page. So to get those materials, you'll just click on that drop down. You'll see the materials that are there. You can click to download those. The promoting, you can see some of our logos there. They have the marketing tools. We have the customizable material, which you can download and edit to meet your needs, etc. And then we have our in-person, and if there is virtual materials for that specific program, they're there, and additional information. Usually all that's in the additional information is the link to the listserv. So that's the email address that if you're a mom facilitator, you're automatically added to that mom distribution. Then at the bottom of the page, we have data collection. So this is specific to each program as well. And it's by method of delivery. So if you're doing an in-person class, these are the steps that you should follow for data collection, what you should print off, when you should distribute, and ensuring that you're returning the material no later than 2 weeks after the end of the workshop. If you're doing it virtually, these are the steps, which links that you should use. All right, I'm going to go back to the top of the page. We still have our workshop notification form. That's the same exact form that you're all used to. It's just that this button is right here. The program management, WW, stands for Workshop Wizard. That's our new database. We're not currently using that. Don't worry about that quite yet. That's that piece where if somebody registers, it will come to you. We'll be working on onboarding people for that over the next couple of years. We think that will take, a little bit of time as we get people rolling with that. So don't worry about that quite yet. Any questions on the resources page? They're all set up similar to this. All right. So I'm going to go back to program resources. just say other things at the top. So program requirements, that's again, those minimums and maximums per class, how many leaders you need, etc. Virtual delivery resources. This is a sheet that just kind of shares like how to Zoom or how to Teams. And that's like, there are separate documents created. One is for participants. If you want to use our materials and send it to your participants to help them figure out how to download Zoom or become more comfortable with Zoom, that's great. There's also some for facilitators as well. So what you would see as a facilitator on your screen and how to do that. We have a volunteer management page that we've recently talked about on office hours. So that's where that material is, how to recruit and retain volunteers. And then our COVID-19 safety plan is listed here as well. All right, so I'm going to go to initiative resources. So this again is where you would find the materials or the resources for the different initiatives that WIHA does. The other page under Age Well just talks about what the initiatives are. So if you were to go to any of these, you can download materials to use in your newsletters, on your social media, wherever you see fit. So this just as an example, these healthy aging tips, we have all of these. You can click to download these. You can customize these as you'd like, and then use them as you please. We also have our coalitions group. So WIHA currently is involved in the Wisconsin Coalition to End Social Isolation and Loneliness. So that's WISL, and the Falls Free Wisconsin group. So if you're a part of one of those coalitions or you want more information about that, that's where you would go for that. News for Professionals is where you as program providers come if you want to subscribe to that newsletter. I think all of you are already on it currently, but that's where you would do that. You can just click that to fill out our form here. And then all of our WIHA updates, which we publish, will be published here as well. So you can kind of have a history of that if you'd like. And then we already talked about all three of those. And then on our refer page, this is for individuals who would like to make a referral into a program. So I'm still working on the referral button. So right now it just shows up exactly like our old button did with the form. That will be updated, but right now it's not. And then in addition to making a referral into any of the WIHA programs, we have these little one-pagers that kind of provide information about what the condition is, how prevalent the condition is, and then like if you're looking for a program to help you with this, check out the WIHA website, and so it can just link to that. So those are really intended for program providers, or you as a healthcare providers, or you as a program provider could use these as well if you're just providing very generic information to try to get people to come into your class or kind of initiate that information. All right, and then we have our give page. So that's if you'd like to make a donation or know anybody who would. On our jobs page, we do have our two positions that are listed with WIHA. So we talked about those, our Falls Prevention Program Coordinator and our Chronic Disease Program Coordinator. We'd love to have some of you apply to those, although we don't want to steal you, but we do want to steal you. Or if you know others that may be interested, we'd love you to share that page or the link I shared earlier in the chat box as well. Then we have our About page. So this just provides some background information to WIHA, our mission and vision, principles, history, board, partners, and staff. And all of you are listed under our program providers. So we have this little map that lists, look at all of our program providers over across the state of Wisconsin. So that's great. We love to see that. And then there's the contact us. So if you're looking for contact information for any of our WIHA staff, you'll find that on this page, or you can scroll down and just do a generic contact us through our form button here as well. Here's our find. So if you're looking for something that you can't find, you can just do a quick search of the page. And then at the end of your session, when you're ready, you can click log out to log out of the page. Any questions or initial feedback?
Looks
They
like
got
we
it, Erin. It's all there. It's good. Everyone's got it. I mean, I will say, Erin has done a remarkable job of this. This has been, what, 10 months in process,
Yeah.
probably. So really an amazing job of spiffing us up, and it'll take everybody a little time. Just, take some time when you have some, and just kind of cruise around on the site a little bit and kind of acclimate yourself to it, because it is definitely different in terms of the way it navigates, but I think you're going to love it once you get used to it and get your login, so that you can access your programs and those tools. So kudos to Erin for all the blood, sweat, and tears that went into this site, because I know how much work it is. So
Yeah.
terrific.
If you have not already, I know there are some of you on here that have already, but if you haven't created your username and password yet, you may want to do that soon. So just go to that login page, and then there will be right here, there's registration instructions. So that will just walk you through step by step. And then otherwise, you can just click this register button right here and then walk you through. There has been some confusion with the new page, and people are using the old username. So like WIH @SO. Please make sure that your username is customized to you. Don't use one of those old WIHA usernames that we've provided in the past.
Erin, there's one question from Allison. She tried to register and it said her
Yeah.
email address was already in use.
Is that
So-
Allison Brunette?
I'm
guess
not,
so.
it's Allison.
And yes, Allison, I can reset your password if you'd like, but since you helped to demo the site, you already have a username. You can email me and I will help you figure that out.
Okay. I think we got it.
as program providers, let your leaders, your facilitators know, hopefully that you can help walk them through this. If not, obviously they can contact us at WIHA. I did send out an email earlier today that went out to program providers and leaders. So if you get it twice, that's why it went out to program providers and also leaders. So you can delete the second one, but yeah, if you could please spread the word and get your folks all set up for it, that'd be great.
Yep. And watch the short video, because we don't want you to get to a point where you need to access your materials and for tomorrow and you haven't registered yet on the site. So, there is a little tiny lag time there for Erin to look up your programs to make sure you have access to the correct one. So the sooner the better.
Yes, I am. I do say on the website to please allow 48 hours for approval. I am doing that as quickly as I can, but right now I'm getting I've got 100 responses or requests this morning. So I'm doing it as quickly as I can, but please don't wait till the last minute to do that.
Okay. Well, I'm sure there'll be more questions, but again, I encourage you to go drive around on that site a little bit and see what you can see there, and we're interested in your feedback. So if there's anything that you're finding challenging, let us know, and we're interested in we'll try to make it better for you. All right, and we're back. So now you've seen sort of what the site looks like and how we're thinking about this direct consumer engagement as part of the website. And you'll be seeing kind of more content come there. But how do people find out about the website? So our plan for doing some direct consumer communication is to launch a newsletter. As you may remember when Erin was talking about the barriers survey, people were interested in getting a newsletter from, local aging offices, public health agencies. So we have sort of started and drafting what a newsletter would look like that would go direct to consumers. Again, with the idea that we're trying to prime people for being enthusiastic about taking a workshop. So we know that it's going to take some time for people to both know who WIHA is especially when we start reaching out beyond the borders of the people who've already taken programs that you all have been providers of. So, but we see a newsletter as being a great way to kind of continue to inform people both about the programs and about healthy aging practices, because we know not everybody's going to be able to take a program, but we can continue to educate people about the practices that can keep them healthy. We'll be utilizing social media, and WIHA, of course, has a social media, a Facebook page. We have Twitter also that we don't use quite as much, and so we'll be continuing to use and beef up our social media presence, and we'll be likely, expanding that, boosting posts and doing some paid media with social media to expand into the areas of people who haven't intersected with us or with you in a program. We plan to do some consumer webinars. So, as we do things like office hours now or webinars on specific topics, like I'll talk about the falls prevention stuff coming up in a little bit. We want to also have some consumer focused webinars that we would invite people to, but that you could also invite people to around topics that they've identified as important. We have information on brain health, for example. So maybe we would package up a webinar around, ways to maintain a healthy brain that also links people over to our physical activity programs, for example, and, some of our other programs, because we know there's a connection there. We've talked about having a consumer track at the Healthy Aging Summit. We're not 100% sure if we're going to have a Healthy Aging Summit yet at this point, given, sort of all the transitions that we're doing. It may not happen next year, but I think at some point we intend to be able to bring that Healthy Aging Summit back in some form. So potentially we could offer consumers access to some of the offerings that we have at a Healthy Aging Summit or some other type of event that consumers can access. And then traditional media outreach we'll be doing. We'll be talking about the principles around healthy aging, in addition to the programming, utilizing newspaper, radio, some of the other traditional media sources. Who's going to get the consumer content? Certainly past participants of WIHA evidence-based programs. We'll be connecting with, our database has past participant information, some of which is email, but it will be delivered via email, this newsletter. And we can discuss additional ways that we might be able to provide it to you. We want program providers to, folks that may not have taken a WIHA program, but are part of your distribution list and you choose to share it with those folks. We want to make it available to you so that it's shareable with them. As Erin showed you, we're going to have places where people can be new subscribers. So they can affirmatively put in their information so that we can access them, send emails to people who, again, haven't intersected with us in the past, but happen to follow onto our onto our website. Constituents of partner organizations. So other organizations that may not be program providers, but through whom we can send information. I don't have any deals going at this point with anybody yet, but we have great relationships with organizations like AARP Wisconsin, for example, and others that we may try to work together with to be able to send, whoops, that went a little too quick, send information to folks within that are represented by them. And then the general public, again, through traditional and social media outreach, we'll be looking to expand the numbers of people who are engaged with WIHA beyond the participants of programs to be able to grow the number of programs that we have or the number of people that we have in programs. This is just a little example of what a newsletter might look like. Again, we're just sort of in the development phase of this. We really did want to look at the barriers survey and have a better idea of the kinds of content that people are interested in. But certainly, an initial issue would have a welcome to WIHA, sort of explanation of what the organization is and how people can utilize our services and information. there's probably going to be a lot of top 10, top 5 type lists. People tend to prefer small bite-sized pieces of content to long kind of articles that are heavy in text. So we'll be developing things like that will be part of the newsletter, that are easy to digest and easy to like have the main themes of the article be very apparent. Things around falls prevention. Certainly there's going to be focus on the programming. So we want for some of the articles to be making the case for why someone should consider taking a program, but also why they might want to know, that what kind of footwear they wear can make a difference in terms of their falls risk. So we want to give them information that might lead them to go to the athletics shoe store and pick out a different type of shoe. We also want them to consider taking a program, and we want to direct them to the programs that are in their communities. Something maybe on brain health, because again, we've learned brain health is important to people and it's one of those topics. Something around physical activity. So we want to build this to be not overwhelming to people, but to provide the kind of information that will begin them thinking about what an action plan for healthy living might look like for them, and that we can provide them the link to the tools and resources in their own communities, and via WIHA potentially to be able to make better health choices. How this supports providers. How does this help you? Because really that's where we started with this is, what is it that we can do to help support providers? We are as good in terms of sharing information and supporting people in communities as our provider network is and has been in delivering programming. So we think this is going to raise awareness. The more people are hearing about programs on a regular basis and about thinking about their health and behavior change and sending messages about self-management, the greater chance we're going to have of people looking for and taking a program. So we want to be this trusted source of health information to local consumers with a Wisconsin focus. A lot of the other health information might be good, interesting, but it doesn't connect them necessarily with something that they can do locally. And so we want to be able to provide that kind of connection. And as Erin said, easier registration at some point, and not today, but once we have more people sort of loaded up onto our portal, and that's sort of our data management system that's coming along, not quite here yet. Once we get to that point, it's going to be easier for people to just directly register from our site. So connect directly to your program in the Find a Workshop and be able to register rather than having to take an extra step and make a phone call or send an email. And now I'll hand it back to Jill.
Sure, yeah, thank you. So that is, and just connecting it back to kind of how I was introducing this, is the reason why we're doing all this, obviously, is to support you, and why we think the strategy will work. Is we know that best practices in marketing show that when somebody has a trusted source of health information, that then they're more likely then to engage in programming, engage in services once they've had that health information and that relationship established. So you all have such wonderful relationships with people in your local communities. And we're looking to be, like I said, that overall healthy aging resource in general, and then pointing them to you all for programming. And I know that you all do such an amazing job with getting the word out of your programs. So this is not meant to be, it's meant to, like I said, supplement it, but really to provide that health information overarching in the beginning, so that then when you're all promoting your programs, they're more engaged and ready to do so. So what happens when we have issues of supply? So we know there's capacity issues. I know a lot of you do many of our programs. We know some areas aren't able to provide all programs, or maybe only one, or very, very small amount of those programs, depending on your capacity and your resources. So we've thought about that as well. And really what we want to be able to do is we're trying to figure this out. I'll just say that off the bat here is we want to be able to maybe offer additional programming opportunities, whether it's statewide virtual workshops in certain programs to make sure that they're available statewide so that when this awareness is slowly happening, hopefully sooner rather than later, that people will have an opportunity to participate in a program no matter where they are in Wisconsin. But we also are very sensitive to the fact that we do not want to take away from everything that's happening locally. That's what our ultimate goal is to point them to you for as much capacity as you have. So how we balance that in different parts of the state is going to be something that we're going to continually want to have conversation with you all on. But our initial thought is there a way that we can provide maybe a virtual program? So, regardless of where somebody is in the state, maybe there's always a virtual class happening, virtual workshop happening, maybe quarterly or once every 6 months, or depending on how that might work for each one of the programs. So that if there is something in your area that you want to promote, there's a program that maybe you're not able to offer, but you want your community members to have access to it, that would be one way. We know that there's barriers to this. We know that not everybody obviously can engage in virtual programming, or that they even want to, is the survey that Erin was demonstrated. So there are some different things that we need to work through on this, but we are very aware that we want to be able to meet people's needs and not be directing them to nothing. So that is something that we're talking about. There are some challenges to that, but as we get, as far as WIHA capacity goes, but as we get more staff and are evolving as an organization, this may be something that we're able to offer. Again, we would love to hear your feedback on this, thoughts about how that may or may not enhance what you're doing. Because like I said, that's our ultimate goal, right? So please let us know thoughts of how that might work or might not work in your area, and we're just going to continue to explore that. So yeah, I think I described this, but we really want to make sure that that menu is available throughout the whole state as best we can. Okay, thoughts, reactions?
Yeah, curious to know what you all think about this. It's, I mean, maybe doesn't seem like a radical departure in some ways from some of what we've been doing. We've really tried to listen to the challenges that people have talked about, from capacity to funding to, the COVID challenges that have, not necessarily made it so that you can just go back to business as usual. So we hear and understand that, and we wanted to find ways that WIHA could continue to support this because it's that important, right? It's that important that we're able to, help keep people healthy and independent and age in place. And all of these programs are so critical to that. So I think we understand this will take a little time to digest and think about, yeah, okay, but if you do that, what about this? So we really do want to hear what your thoughts are as you've had a little chance to think about it. But again, we hope that you view this as the way it's intended, that this is meant to augment what you're doing. And we hope that by raising greater awareness of these issues and these programs and these practices that can support healthy aging, that more people will be taking your programs and you'll be able to fill them, and you won't have the cancellations for not being able to fill classes. That's just been the biggest challenge. What we've heard from people is just not being able to fill classes the way it worked before. All right. Well, so there are a couple of other things we want to talk about, and maybe the best way to do this Sorry. Yes. There are several other things going on at WIHA. And by that, I mean like different initiatives that WIHA has been working on. I think Erin kind of gave you an idea of what's happening in terms of facilitator training for 2023, but I'll give that back to you, Jill, to talk about a little bit more.
Sure. So on the new website, you can see our 2023 leader training schedule is released, and we timed that just perfectly right when the new website tried. We did that. We know that, you know, a lot of times you all are planning now for something that's going to be happening in 2023. So we wanted to get that as soon as possible. So just like last year, the leader training schedule is going to be ever evolving. So if we add a training to that schedule, it'll be added in live time. So I would encourage you to look back at that training schedule. If there's not something that you see, maybe in 2 months or so, maybe there will be. So as we are meeting needs, we may be adding things as trainings are canceled, since it's happened quite a lot since in this new era here. So we have sometimes canceled training, so that will be ever updated on that master schedule. We do have some of our trainings that may have more like to be determined. We have like a general, maybe location. I think there's a couple workshops that are, trainings that are going to be happening in person. We have general areas of the state that's going to happen, but we don't have a secure location yet. So some of that information will be updated. Those details will be updated as we get them, but we wanted to provide you with at least a month and or dates and times as much as we have for each one of the programs as we have them. And like Erin said, the training fees, we don't anticipate any major changes to those for next year, but we are still going through that process right now. So those will be updated by the end of the year, and you'll be notified of any changes that happens. But please encourage your community members to be enrolling in the leader trainings even now. The links should be live and ready to go. If there's any challenges with those, let us know, because that was just done today. So hopefully we're all ready to go. So please do that. With that, our 2022 leader trainings are still happening. We have a diabetes program training that's going to be going forward, that's starting in October. And we've got some extra physical activity trainings that are happening as well. So still things are happening in 2022. So make sure you get your registrations in at least a month before each one of the trainings starts, because that's when a month before is when we have to decide whether or not to go forward or not. Also, we have to close registrations due to other factors like getting materials printed out and mailed and things like that. Erin, do you want to add anything to that?
Yeah, for some of our programs, it really should be more than a month. So our deadline for completion of basic training or other things is the month before. So you want to give yourself longer than that, preferably 3 months, so that you can have plenty of time to complete some of those to-do items for some of the programs.
Great. Thank you. Thank you. And then one last thing I want to point out, as Erin was saying, when you're registering for the new website, we have the program requirements on the page, on that program content page. We've had it on our old website as well. Just so you are aware, as we are doing a more thorough job of going through our database to ensure that our records are up to date and complete. That's an ongoing, ever-changing thing. So this summer, we had one of our interns was working with us to connect with people to maybe update contact information for your organization, see if you're still planning on doing activities and doing programs. So please let us know if there are changes so that we can make sure to keep our records up to date. So you may have heard from our intern, may be hearing from me in the future, just to kind of check in, see how things are going, to make sure, are you guys still providing this program? Are you going to be discontinuing it? Those kinds of things. So let us know as much as you can, and usually you guys do a really good job of that, so thank you. And then with that is updating leader and facilitator active status. So We know that it's a challenge sometimes to make sure that if there's canceled classes happening, that your leaders are and facilitators are getting workshops in order to maintain their certification. However, we do need to, because of license requirements and program requirements and fidelity and quality assurance and all that kind of stuff, we do need to remove people from our database as active facilitators when they haven't led a workshop according to that program requirement. So if you have any questions on those, obviously reach out to the program leads in those areas. But I think they're all on the website. They are, I should say, I think they are on the website. So you can see that, Mind Over Matter, you need to do 2 workshops per year or whatever. And, we're really, we try to be really flexible with that as much as we can, but there are limits to that. So if you have a leader that hasn't led in 6 months past whenever that deadline was, then they will be removed from an active leader list. We try to do our best to notify people as much as we can, but without notification, because it's just too difficult to do that. So we're doing our best to be able to maintain those records, and please let us know as much as possible ahead of time. Would be great. So thanks.
Thanks, Phil. And bringing up the rear here, just want to remind you of a couple of things. It's Falls Prevention Awareness Month, and you all should have received some email regarding the tools and resources that we've developed for Falls Prevention Awareness Month outreach. Here's some homework. Go to our website and find those tools and resources. That'll be a little scavenger hunt for you to see if you can find those easily, and I'm sure you will. So take a look at the resources we've developed. We have some new, a sort of suite of new Facebook posts that you can use. You can put your own messaging sort of with those to direct people to a Stepping On program, for example, or something else. So those resources are there. There are also flyers for a number of different falls prevention activities going on around the state in local areas. In addition, we will be having a webinar coming up on the 21st with innovative falls prevention activities going on in the state. So I keep teasing this, but the Oshkosh Fire Department is going to be talking about its Mugs for Rugs program, which is really cool. And I think you should all come just to hear about that program, in addition to all the great things that Safe Communities doing with their Only Leaves Fall event and what Brown County's Falls Prevention Partnership is doing in that location around with their referral programs. So Jody's asking if that will be recorded. Yes, indeed, it will be. So, but do find there's a registration link on the Falls page where you'll find the other resources. So that's one little piece of homework there. And again, come to the WIHA Facebook page if you just want to share from our page. You can always do that. And we've been putting resources out pretty regularly, pacing them out throughout the month. Loneliness and Social Isolation Awareness Week is coming up also in November 13th through the 19th, working on a governor's proclamation for that. We are going to have a variety of activities going on. One kind of focused on what we're loosely calling the How's Your Neighbor, the How's Your Neighbor initiative, where we're going to really be encouraging people via letters to the editor and other things to check in with people who they think might be lonely in the community. So we'll have a whole sort of series of information around that. And we'll have some webinars also going on, one focused on voices of the community. So we're going to hear from people who've experienced loneliness and social isolation in a variety of different communities, people who are disabled, people from different cultural communities, rural, urban, just to kind of get a better idea and understanding of the experience of loneliness and social isolation. And then we'll have a second one that's focused on different interventions that are happening that have been identified as successful in terms of reaching people who are lonely and isolated and making an impact. So watch for information about those two things. We don't have them scheduled yet, but we are building them. And lastly, I'm just going to really briefly mention, because this is related to the Falls Prevention Program Manager position. WIHA received a substantial federal earmark resources coming to the organization. We have a year, and we're going to be building what is called the Falls Free Wisconsin Center. It's not a place; it's a movement. It's a virtual space that we'll be creating around falls prevention with partners from a variety of different places, from public health to emergency services to healthcare to, of course, our dedicated partners in the aging network and ADRCs and aging housing, senior housing and senior centers and everybody. So we've already developed a coalition that's working on some issues around falls prevention, but we see this as an opportunity to really raise falls prevention awareness and tools and resources and get them into the hands of people, while at the same time working together with the trauma centers and the fire departments and EMS, and trying to come up with strategies and interventions that will help support people who are falling regularly and get them into both programming or find other supports, including, home modifications and other things. So it's a big, audacious task that we have. We're real excited, and maybe that sweetens the pot for some of you who might be thinking about that position, because it'll have a lot to do with what that position will be doing. So just wanted to mention that as something coming up. We're going to be talking about falls a whole lot over the coming year. And of course, we'll be looking to you for your input and support, and we'll continue to be here for you as well. So I'm checking the chat. Is there any other?
We were just talking about how awesome Jody is.
He's got 14 people signed up for stepping on. Atta girl, that's terrific.
Super excited about it, people, just to let you know. Oh my gosh, I'm so excited. And it's in person. Holy buckets, it's going to be awesome.
Great, good for you, Jody. That's great.
Great job.
Well, and on that inspiring note, unless anybody has any other questions or wants to add anything. Going once, twice. Hearing none, I will call this meeting adjourned. Thank you all for joining us. Great to see you. Take care, everyone.
Take care. Be well.